So today we're going to show you some examples of laser treatments using Q-switch lasers for tattoo removal in our office here in Worcester, Massachusetts. We're going to show you an example of a typical laser treatment with the TriVantage laser from Candela using the alexandrite attachment. We've applied topical anesthetic cream, and I'm going to put some saran wrap over it for about 10 or 15 minutes to help it penetrate. Here it is with the anesthetic applied and the saran wrap. So this is the alexandrite 755 nanometer Q-switch laser from Candela. It's called the TriVantage. We're doing it in the alexandrite mode, and this is a tattoo that we treated before. This is a 3mm spot. We can go up to a 4mm spot with this, down to 2mm. We're going to give the patient a rest here because I can see it's bothering him a little bit despite the fact that we put topical on. Nearly done. We have topical anesthetic on underneath cellophane for about 15 minutes. It's still a moderately painful experience. Listen to the snap in the areas that have not been treated yet today, and then you'll notice if I try to go over an area that's been treated, you don't hear the snap as much because the laser beam has already been absorbed into those tissues, and this laser beam is not absorbed into white or gray, which is the temporary color change that we have. It only gets absorbed into the black. Done. If you look very closely, you'll see that there are some red spots in this area. We call that pinpoint bleeding. That means that the laser has penetrated down to the dermis, to the mid-dermis, which is what we want. And now we're going to put some Tegaderm on this, which is a semi-porous plastic-like material. Stays on 3 to 5 days. All our patients get a prescription also for Silvadene in case of blisters. Treat this with a 2mm spot size. We're going to treat just the name. Again, this is 755 nanometers. Alexandrite. A little bit of snap is good. We do a lot of this where we're removing names from tattoos. Little bit of pinpoint bleeding, which is fine. Means that it's penetrating nicely. Done. This is a tattoo that we'll be treating today. This is how it looked before we began treating it a number of months ago. We've treated this both with the alexandrite laser and with the YAG laser. The YAG is better for red. The alexandrite is better for the green, or turquoise in this case. So what remains here is the red flower and the green.
Red heart and green peace symbol.
Yeah, red heart, green peace symbol, yeah.
But we can't recognize them, so that's a good sign.
Yeah, so that's the patient talking. So we're going to treat at 532 nanometers, which is using the YAG wavelength on the TriVantage, and at 755 nanometers using the Alex for the green part and the red with the YAG parts. It's a little less light. It's getting so faint it's hard to even see it through here. Okay, we're going to pause now and change the wavelength to 532 nanometers to get the red. Whereas sometimes you tend to get a little whitish discoloration as you treat with the Alex. With the YAG wavelength, it's usually more brown or red. Done. So this is pretty typical appearance after treatment with the two different wavelengths. A little more red, a little pinpoint bleeding from the YAG, not from the Alex.